bleeding during pregnancy is common and normal. It can occur anytime between the 4th and 8th months of pregnancy. Although it is not a serious condition, it can be quite scary for a number of reasons. In addition, it is important to understand that bleeding during pregnancy isn't always a symptom of a serious medical problem. It is most likely that you are experiencing an early miscarriage or a threatened abortion. However, it is difficult to tell the difference between the two. Early miscarriages and threatened abortions are usually similar in terms of the symptoms and the treatment that you need. How much bleeding during pregnancy is normal? Vaginal bleeding is normal when they notice a few drops of blood occasionally in their panties or if they wipe themselves with tissue and see a little blood on the paper. What are the causes of vaginal bleeding during the first trimester of pregnancy? Number 1. Ectopic pregnancy. The most common cause of vaginal bleeding in pregnancy is an ectopic pregnancy, which is a condition in which a fertilized egg implants itself outside the uterus. Ectopic pregnancy can lead to severe bleeding, which may be accompanied by severe abdominal pain. It can also cause other symptoms such as dizziness and fainting. Number 2. Implantation bleeding. Implantation bleeding is a relatively common phenomenon. Implantation bleeding is a very light vaginal bleeding that occurs in the early pregnancy. Implantation bleeding occurs when the fertilized egg attaches itself to the lining of the uterus, and this most often happens around 6 days after conception. Implantation bleeding is a little different from a normal period in that it tends to be a little lighter in color, but it can be similar in duration. There are many times when the woman does not even know that the bleeding is due to implantation. However, if this bleeding is noticed, the woman should know that it is okay and it is a sign that she has gotten pregnant. Number 3. Miscarriage. Bleeding during pregnancy is a sign of miscarriage. The American Pregnancy Association reports that about 20 to 25% of women experience vaginal bleeding in the first 20 weeks of pregnancy. It's important to note that the bleeding may not be obvious. In fact, only a small percentage of women will experience bleeding that is heavy enough to need a call to the doctor. In many cases, the bleeding can be mistaken for a late period. Number 4. Molar pregnancy. Vaginal bleeding during pregnancy is a cause of molar pregnancy. A molar pregnancy is a rare type of pregnancy in which a mass of tissue called a mole forms instead of a healthy baby. Molar pregnancies are an abnormality that occurs when an egg is fertilized by 2 sperm. The fertilized egg or zygote begins to grow, but instead of producing a normal baby, it develops into a mass of tissue that looks like a grape. This mass is called a chorionic villus. Molar pregnancy is a rare occurrence. It accounts for about 1 in every 1,000 pregnancies. Of those, about 1 in every 100 women with a molar pregnancy will develop cancer. Number 5. Problems with the cervix. There are many problems that can occur with the cervix, such as an inflamed cervix, cervical infection, or growths on the cervix. How to stop bleeding during pregnancy. While there are no specific treatments for reducing bleeding during pregnancy, there are certain remedies that may help reduce the amount of bleeding around this time. These include: Number 1. To reduce bleeding during pregnancy, use pads instead of tampons. Number 2. To reduce bleeding during pregnancy, get plenty of rest. Number 3. Avoid intercourse with your partner while bleeding. Number 4. To reduce a pregnant woman's likelihood of bleeding, consult a physician for suggestions about mild pain relief medications. What is nosebleeding during pregnancy? Pregnant women can be susceptible to nosebleeds during their pregnancy because the vessels in their noses dilate when there is an influx of hormones. During pregnancy, a woman's body will see an approximate 50% gain in the supply of blood throughout her entire system, which puts pressure on all the organs and vessels, also includes nosebleeds and other symptoms related to hormonal changes.